Hi, Margaret. We're going to go over skill A, which has to do with putting information together. I'm going to ask you a few questions, but I'm not really going to give you any feedback at this point. I'm going to give you written feedback in your folder, okay? So what can you tell me about this patient from the chart?
Well, Mr. Williams is a 65-year-old male who has atrial fibrillation. He has a CHAD score of 1 for hypertension, and this morning was the last time we checked his INR, which was 7.5. Up until now, he's actually been very stable and has therapeutic INRs each month, which are in between 2 and 3, which is his range. He did not report any unusual bleeding as far as blood in the urine or in the stool, so it's just been the recent nosebleeds that he's complaining of. He was actually pretty surprised that his INR was high today, and he's been on warfarin for the past 12 months, and this was since he had presented to the ER with signs of a transischemic attack. When he went to the hospital, they did a couple of tests, including the head CT scan, also the transesophageal echocardiogram, both of which were normal, and so he's actually been feeling fine ever since. He does have hypertension, he does have osteoarthritis, for which he had a total hip replacement done about 6 months ago. Medications are atenolol 50 milligrams daily. He's on ramipril 10 milligrams daily. He's also on amiodarone 200 milligrams daily. And then the warfarin dose he's on is 4 milligrams Monday, Wednesday, and Friday, and then 2 milligrams all other days. Today, his primary care physician has asked us to take a closer look at his dosing. They've admitted him to the hospital because they were a little worried that the INR went up so quickly, and he's also having signs of bleeding. And so we're supposed to give a recommended dose.
Okay. So describe the relationship between warfarin and INR.
Okay, so warfarin is a therapeutic anticoagulant, and so the INR basically measures the level of anticoagulation, as well as can really monitor for safety and efficacy of the warfarin. Warfarin is also a vitamin K antagonist, and so it's a good way to measure the balance between warfarin and the vitamin K clotting factors, dependent clotting factors, which warfarin is supposed to inhibit. So if a low INR level actually means that the patient is not being protected from thromboembolic events, because the warfarin is not doing it's insufficient for the events. However, if it's high, that means it's too much warfarin, and so the risk of bleeding is increased.
Okay. What do you think is behind this increase in Mr. Williams' INR values?
You know, it seems that he has been very stable for the past 12 months on the exact same dose and always within range. So all I can think of is it has to be something recent and something acute that has changed to cause such a large elevation quickly.
And what could one of these acute or short-term things be that would affect his INR values?
Consistency in diet and medication use is really key to preventing the fluctuation in the INR. And so specifically maybe prescription drugs, over-the-counter medications, when those are changed, that will cause variability in the INR. For example, he's on amiodarone, so if the amiodarone was increased or decreased, we would have seen a change in the INR for sure. In addition to that, irregular alcohol use, tobacco use, changing your diet, eating more vitamin K rich foods, that can also cause fluctuations. And so if you have binge drinking, for example, a lot of alcohol, that would cause an elevated INR. Whereas if you have a lot of vitamin K rich foods, that would cause the INR to go down or to decrease. Another big factor is the patient's health. Illnesses, maybe he's recently been under a lot of stress or antibiotics, gastroenteritis, that would cause diarrhea, vomiting, which would affect warfarin absorption, and also, it would deplete a lot of vitamin K from the gut, which we would see the INR increase.
So what would you want to ask Mr. Williams?
Well, I want to see how he's feeling. I want to see if he's feeling sick, if he's been ill recently. Maybe he's had some changes in his over-the-counter medications or prescriptions. Maybe the amiodarone was changed. Also, I would want to see if there's any changes in his diet or alcohol use that would cause the increase. And then compliance. I want to make sure that he hasn't missed any, and specifically right now that he hasn't taken any extra warfarin.
Okay.